Hey guys, so last week on Thursday, which was February 1st, I had a hernia surgery, as many of you know, which was coming up, and I'm recovering well. I didn't really necessarily want to talk about that, but actually kind of discuss another topic that kind of came up. So every time I go to a doctor's office or any setting like that, I end up with elevated blood pressure. It's called white coat syndrome, and a lot of people have it, including people that work in the medical industry. It's very normal. And because of these, there's a lot of guidance around how to diagnose blood pressure and it not being in a office setting. So in general, the recommendation is going to be, don't do so in a hospital or doctor's office type of context. So when I was processed out of surgery, I got kind of a similar treatment that I've gotten from other medical professionals that I've worked with, which was basically to pressure me to hop on to blood pressure medication. I have received similar treatment from doctors that I've seen, especially primary care providers. They do prescribe a lot of blood pressure medication. It's sort of a bread and butter product for them in service. And in my case, I check my blood pressure at home, just like I recommend everybody do. And what you should be doing in this type of situation is seeing what you can do to manage your blood pressure with diet and lifestyle and whatever else. But there's no free ride with drugs. Just taking drugs to compensate for how, the inconvenience of changing your diet or something like that is not a free ride. It's not going to lead to better health outcomes than if you were to just deal with the problem. Now, in my case, I had, some discussion of my blood pressure, which was in where it usually is in this type of context, 155 over, I think, 100 or something like that, which is where it usually would be if I'm in a doctor's office or something like that. In this case, I just woken up from surgery, so there was probably some stress. I was in quite a bit of pain and discomfort, so not really surprised at where my blood pressure was. And I also know that a lot of people might also have a similar condition. And these nurses, for a living, process people out of these types of contexts where they're having surgeries. So why they were so dumbfounded is still a mystery to me. However, one of them even said something along the lines of, well, you're going to have a stroke or something along those lines, which is what a primary care provider said to me just a few months ago when I was trying to find a new primary care provider, and that didn't really work out. So what I did when I got home several hours later was to check my blood pressure, and it was about the same when I checked. I think it was 155 over about 100 or so, which didn't surprise me, with a fairly elevated heart rate, probably from the stress of the surgery, that kind of thing. So what I did was I did what I normally know that I need to do to manage my blood pressure, and that's get more salt. So I took 2 salt pills, each of them a gram. So I took 2 grams of salt, which is not a whole lot for someone my size. I weigh 260 pounds. That, within 10 minutes, I think 15 minutes, I checked it again, lowered my blood pressure to 125 over, I believe, about 84. We'll show the pictures so you guys can kind of get an idea. But you'll see the before and after. There's 15 minutes between these readings. The only thing that happened between those was I took 2 grams. And actually, when I took the first one, I had been sitting in the same spot for like an hour or so. The only thing that happened was I took those pills and I had to go to the bathroom. And then I sat back down. I'd only been sitting for about a minute or two. And immediately the high blood pressure condition was rectified with an elevated heart rate. And normally an elevated heart rate will lead to higher blood pressure, but that even wasn't the case. My heart rate had actually gone up in the second reading. Blood pressure still went down because it was managed. Had I listened to the panicky people that I've had to deal with, I would be on blood pressure medication right now and putting strain on my kidney that didn't need to be there. I'd probably be dealing with feeling dizzy when I got out of bed once in a while or got out of a chair because I don't have high blood pressure. When I check it in the mornings, it's normally in the mid 120s over mid 70s, which is perfectly fine and healthy. Sometimes it's even in the 1 teens. What I recommend everybody do is to follow what's official guidance and not even something that's unique to me. I didn't invent this. This is just among those who are competent doctors what they'll actually do. You check it at home. You check it at home first thing in the morning. Get up, go to the bathroom, and go sit down or lie down. Let your heart rate settle if it started beating or whatever from getting up. Maybe you read or something along those lines. But once you're settled into sitting or lying down again, check it once a week. See what it's doing. That's the best time. You need to know what your heart is doing, or what your blood pressure is doing rather, at a time when you're coming out rested, not when you have the variabilities and the variables going on of day-to-day life and stresses. It's going to go up during the day normally. That's okay. There's nothing wrong with that. You don't want to go too high, obviously, but heart rate variability is normal and acceptable and good, especially depending on the conditions. If you have a stressful work environment and you're driving in traffic, your blood pressure will rise. This is a stress response. That's okay. Your body is designed to handle stress. What it's not designed to do is have high blood pressure while you sleep or all night, and you're not going to be able to recover. And you end up with damage to your arteries, enlarged heart, kidney damage, things like that. So if you really want to know what's going on, check it at home under those types of conditions. You can check it at night as well, shortly before bed, as long as you've been sitting for a little bit. And if you're sitting, make sure both feet are on the floor and your legs are not crossed. Make sure you're in a generally relaxed position, and make sure the cuff is about level with your heart. If it's on a forearm or if it's on a wrist cuff, then you at least hold the arm and relax this arm and use this arm to prop it up. You don't want tense muscles because that will influence your blood pressure. It shouldn't be that hard. It's something that everyone should do on a weekly basis, and I certainly recommend that you do so regularly, especially if you're a man or you're someone that's just carrying a lot of body weight, whether that's due to muscle mass or fat. It can be a risk factor. And your first go-to interventions for elevated blood pressure should be to hydrate more, or get more salt, or both, get more sleep, and do more cardio. Usually this comes down to being in better shape and manipulating your hydration and electrolytes. You might actually need more potassium or something along those lines. That's not always the case. That's something that can be very easily established with blood work, and just kind of see where you are. My salt on my blood work, my sodium is always low. It always has been. And I take in extra to try to help, and as long as I know I'm getting the right amount when my blood pressure is regulated. And I've seen this time and time again with other people that are carrying a large amount of muscle mass because they're athletes or they're bodybuilders or they train or something along those lines. If you do those kinds of things, your body will generally need more salt because you're losing it when you train, and that salt needs to be stored in the muscles along with glycogen, water, that kind of thing. Otherwise, you will become dysregulated. You'll carry fluid in places it shouldn't be, and your heart will compensate by having to pump harder through blood vessels to move blood through tissues that have fluid in them that shouldn't. It should be in other places, and the body manages where these fluids are with electrolytes. So that's my recommendation. Try to have a reasonable conversation with your doctor if they're trying to push blood pressure medication on you, and make sure that it's actually something you truly need. And look up some of the American Cardiac Association guidelines on this matter. Do some Googling if you want, and look up some studies. If you have any questions, I can help. I've helped a number of people restore their blood pressure to normal levels, and actually even with the supervision of their doctor, gotten off blood pressure medication because it was no longer necessary after they did some minor interventions. Talk to you guys later. Thanks.